Welcome back, guys. I am continuing on to the series of treating my patients' symptoms and helping them get better throughout the South Bay. And who do we have here?
Angie Portillo.
Okay, Ms. Angie.
Mm-hmm.
All right, now what are we dealing with?
Believe back pain, where it's like I crack my right and it seems to like crack.
Is it back here or is it here?
No, it's back there.
Okay, back
yeah.
there. Okay.
Mm-hmm.
Gotcha. And when would you say it started?
I've been having it for a while.
Mm-hmm.
Yeah, I've been having it for a while now.
1 year, 2 years?
More than 5 years.
That's a really long time. Wow.
Yeah.
Okay. Was there an incident that you could remember that caused it? Okay.
No, I have a tear meniscus, but I don't know if that's probably it. But
So, what would you say like aggravates it?
Isn't nothing. It's like out of nowhere, like twitch, where it's like I get the feeling where I have to like crack it all the time.
Okay. And when you feel it, what are you doing typically that helps decrease it?
Stretch. Stretching. Yeah, I do like the overhead stretch and stuff.
Going back to the knee, do you have any knee pain, or you're pretty good on that? Like what's?
No, I still have the knee pain. I have still the tear meniscus, but I'm having therapy right now, which is helping me. But it's still there. Yeah.
How often are you doing PT for it?
It's been about a month now that I've been doing a PT for it. On my left knee. I had surgery for that one, but then the right one, that's when I squatted and then I heard like a and then I was like, oh yeah. So I'm good with my left knee, but my right knee now is the injured knee.
And you said you had chiropractic before in the past? Is this your first time?
Yeah, I only did it once, but I kind of like left like more injured, I would say. Yeah, but then I just didn't go back.
Yeah, what did they do for you?
They put like this little machine, not a machine, but it was like a
pads.
Like a pad.
Yeah.
That
Was it
sent
like TENS machine?
I think so. Like it was sending like electric waves or I don't know shocks. Yeah. Yeah.
Okay. And did they were treating your knee when you came in? Is that what was happening when you were the chiropractor? Yeah,
they did like some. I don't know. They did like a little. I think he had shifted my body this way, and then he did like a little cracking. I don't know. I forgot.
You felt worse the next day after all that.
Yeah, like it was like worse, and then I was like, oh. Probably it's not that, Then I went to the doctor and they're like, no, you have a tear meniscus. I'm like, oh. Yeah. So I thought it
was just the knee, like not the.
No, it was just the knee. Yeah. But I never mentioned the back, so I don't know. But this is the first time I mentioned like me cracking my back like that.
Okay. All right. Well, let's check you out. Hands are really cold. I apologize.
It's okay.
Let's see. Feel this right here? It's a rock right there. Gotta get that moving for sure. Okay. That's also a rock right here. Yeah, also let me know if what I do increases symptoms, decreases them, or if it's about the same. I'm just gonna press into the head. How does that feel? Felt the same?
Yeah.
Okay. I'm gonna lift it up. How's that?
Oh yeah, I felt it in the middle.
Is that painful?
Uh-huh.
Okay. We're gonna go this way. How's that?
Immediate, I would say. I don't know. Like, it's okay. Yeah.
Okay. We're gonna go this way. How's this?
I felt it right here.
Okay. Is that painful?
A little bit.
Okay.
Yeah.
So we're gonna turn this way. We're gonna bring it back, and I'm just gonna press into the head. Painful.
Yeah.
Okay. We're gonna go this way. I'm gonna bring it back. Just let me know when, and I'll stop.
No.
Okay. The next thing we're gonna do is we're actually gonna have you go on your stomach. We're gonna look at a little bit more at that middle back.
Okay.
Have you go face down. I can take that.
Okay, thank you.
Just put it right here. Alright. So, yeah, that was pretty stiff down there. Yeah, it's like a rock in this middle back area.
Yeah.
Super, super stiff. Come down a little bit. You can relax your legs. Now we're gonna move your middle back. It's time to move a rock. So we're gonna do a big hug. And what you're gonna do is you're gonna take a deep breath in. And you're gonna take a deep breath out. Nice. Breathe out. That's pretty good. Good job.
Wow.
Alright. Let's see what we got up top. So the next thing we're gonna do is, because you're pretty stiff up here, is you want to stretch out this area. Let me see if I can raise this up a little bit more so your neck's more comfortable. And yeah, we're just gonna stretch it out. So what you're gonna do is you're gonna raise this up towards me, basically meeting my resistance. Relax. Let me know if it's too much pressure or too much of a stretch. Does it feel okay? Okay. Relax. Do it again. Relax. Next thing you're gonna do is shrug this up towards me. Relax. Shrugging it up towards me. Just relax your neck too, like just let it drop. Don't want to strain it. You can relax. Okay. So relax that. And next thing we're gonna do is I'm gonna have you go on your side, facing towards me. Yep, you can just lay down. And then you can relax this. That's pretty good. And this is gonna be for your low back here.
Okay.
Take a deep breath in. Breathe out. Yeah, that was good movement. We'll have you go on the other side. Don't fall off. I haven't dropped anyone yet. Don't ruin my record.
Okay.
Go, and then you can relax this right here as much as you can. Straighten this up a little bit more. There we go. And then take a deep breath in. Breathe out. We'll have you on your back.
Oh, okay.
It's pretty good movement. You move really well. Don't move. Give your nervous system about 20 seconds to allow to adapt. Just let everything reset. You work very hard, very stressful job.
Yeah.
And you need to give yourself a moment to embrace the moment and, just let everything go. Don't think about that. Don't think about work. Don't think about any of that. This is your moment to relax. And later today, you may feel really good. Okay. Don't test it out. Don't do anything you normally wouldn't do. You also could feel a little bit worse after this. That's normal. Just like how you felt worse after that first day. Unfortunately, the chiropractor, we kind of make the mistakes at times of not telling patients that.
Yeah.
Because you can feel sore. It's like working out because we're shifting those vertebrae. We're shifting things back into position that haven't been in position in a long time a lot of times. And, that can be a little bit painful to finally put things back in because they were just so used to being locked out. And, just make sure you're hydrating. And if you do feel any soreness or anything like that, just make sure you're icing it down for about 10 minutes per hour as needed. And what we can also do is do some stretches for your leg. Like I'll stretch it out for you. We'll stretch out the good one. We'll stretch out the good one first. You can relax this. Just relax it. And then we do this right here. And then we're gonna bend it forward. Okay, relax this. Then we're gonna do this one right here. You can relax this. Okay. All right. So what stretches are you doing for your knee?
I'm doing the knee forward. This one.
Yeah.
Those.
Mm-hmm.
Then
Is that an exercise that you're doing? You're like just raising it up and lowering it?
Yeah,
okay.
and then that's
bringing it back
this
like
is
that.
another one.
Okay. Okay. So another one that you can do that I find to be really good is since you're already on your back, you can always stretch out because this seems to be really tight right here.
Yeah.
So your quad. So what you want to do is you can basically come over here, and then if you can reach it, can you get the ankle? There you go. Mm-hmm. And then you basically are gonna pull that down towards you, and then you can basically hold that for 20 to 30 seconds, both sides, and I'll do it a couple times throughout the day. And that would, how does that feel in front of your knee?
Feels good.
Good. Because the knee attached, or the quad muscle, it is a hip flexor muscle, but it also attaches to the knee. Mm-hmm. And, tightness of the quad can also, disrupt, the knees, the functioning of the knee overall. Okay, you can bring it up. And can help you stretch this out too. Okay. Now let's have you come up. Okay. How do you feel?
It feels good.
Okay.
Yeah.
No pain or anything like that?
No.
Okay.
Feels much better. Yeah.
Good. All right. So the next thing we're going to do is we're going to teach you something that would really benefit you because I'm looking at you and it looks like that stress is causing a lot of like, you're basically like hunched forward like this. And what we got to do is got to work on pulling that all back.
Okay.
Because whenever we have things hunched forward, that's stressing out your spinal cord, and that's causing a lot of inflammation in the area, and that's gonna wear you down. And what we want to do is we want to get that off. So what we're gonna do is you're gonna take your hand, you're gonna grab the back of the chair,
okay,
and then you're gonna squeeze this chair or squeeze your shoulder blades together like you're trying to hold a pencil. Squeeze more. There you go. And then look up halfway. How does that feel in the middle back area? Feels good? Okay. You will basically do that for about 30 seconds, but every hour throughout the day. I know you're probably constantly running around in the restaurant, but you probably just take every hour, just set a timer for you to just do that real quick. It would be good to at least like sit down real quick and just rip that out. And there you go. You don't know. How does that feel?
Feels good.
Okay. Thank you guys for tuning in to my series, and I will see you guys on the next one.